I was just one of those kids which was a bad combination of klutz and gymnast. I broke a lot of bones. I spent a lot of time in emergency rooms and in doctors' offices, and I was always fascinated by it. To me, it was just people can make people better, and that's great. My specialty is pediatric orthopedic surgery. I chose that for a couple of reasons. One, I think my early experiences as a child athlete and my injuries, it brings it home to me. When I'm taking care of these kids, I'm taking care of myself when I was a kid. Also, when we were residents, it was the first field that I went into that I felt, wow, I'm good at this. I think that as a young-looking female, I think I can relate to the parents and the kids. I'm not very scary. And it was one of those times where the definitive treatment was often in the emergency rooms. As a resident, you're actually doing the definitive treatment, and to me that was uplifting. I am a much more kind of cautious, personable, like to play, like to talk to my patients, like to spend some time, and I think that's necessary for pediatric orthopedics, and I think it's a skill that I excelled at. It was the first time I felt like I was truly excelling in a subspecialty when I went through my residency. I carry my pager and my cell phone all the time. My staff knows that if there's a question that they don't know the answer to and I'm not in the office, they can reach me. Often if something happens on a Friday and it's blood work or knee fluid that needs to be followed up on, I take the phone number and I call that parent over the weekend even if I'm not on call. What gives me the most satisfaction in my work is the reaction of the kids and the parents. When you do right by someone's child, you really make a difference in that child's life. You make a difference to those parents, and the appreciation that's expressed to me is what I do my job for.